For young people who want to be proactive about these issues, if they ever see someone having a stroke in public, there's a few simple steps they can follow to help out, right?
Yes. So the most common stroke symptoms can be summarized in a slogan called Be Fast. So BEFAST. So B stands for balance, E stands for eyes, F stands for face, A stands for arm, and S is speech, and T is actually time to act. Okay. So if usually symptoms started very sudden, if the patients have poor balance, B, E they see something, they see double vision, and F, their face when they smile, there's some asymmetry. A, when the arm raised up, there's one-sided weakness, and when their speech is slurred, and it's time to act in terms of call the ambulance because the patient may have a stroke, and you should get to the hospital as soon as possible. Because currently the treatment of strokes are quite good, and many times patients may be able to fully recover after the stroke.
One of the things that HKU Stroke has done to raise awareness for stroke in young people is publishing a picture book called A Disney Picnic that we want to show right here. Could you tell us a bit about the story behind this book?
Yeah, so I think we are always thinking of new ways to see how we can educate the public, right, on the stroke symptoms, awareness, right? Because if we can prevent strokes, then actually we can really significantly sort of reduce the burden, right, that strokes are sort of resulting. So I think this initiative, we had this opportunity about a year ago, right, where we could collaborate with Mr. Men and Little Miss, and the inspiration behind was that because if we educate children, right, at very young age, right, when they are 4 years, 5 years of age, right, and of course for kids, right, often the time when they read books, actually it's the parents who will be reading together with them, right. So actually at the same time we're educating and empowering two different generations at the same time. So this book is actually, it talks about, Mr. Man, Little Miss, right, the series, right, but through a quite a relaxing story, right, talking about, strokes and the stroke symptoms, right, and the acronym, right, throughout the story, right, they gradually learn about the Be Fast acronym, right. I think the goal was at a very early age, right, when the kids are young, right, to tell them and educate them about the stroke symptoms, but also the parents as well. So that was what this was about.
Okay. HKU Stroke has put out some widely covered work recently, like a TRICH score and a smart rehab platform. Is there a study or development that didn't get as much attention that you'd want more people to know about?
So yes, we actually, we have a range of studies and research. Definitely an area that we're doing, right, and of course Teo is leading, right, is on the intracerebral hemorrhages. These are bleeds in the brain. That's what the TRICH score was about. Smart rehab, right, is basically using AI platform, right, but using just a mobile phone or tablet device to see if we can make rehabilitation more accessible, affordable, and scalable globally. So that was what that was about. But yes, indeed, we do have a lot of different projects, right, because we are very interested in stroke preventions in general, right. We, for example, also look into gut microbiome and brain health and vascular health. We have been very passionate about blood pressure control, right? So I think as long as anything that we feel is interest to do with blood pressure, right? Because after all, right, high blood pressure is the most important modifiable risk factor for stroke, right? So if you can treat and prevent hypertension, right, actually we can prevent a lot of strokes. So actually we have a lot of things going on, right. Some are quite simple questionnaire-based research, right, why that Teo is doing, right, why patients are not getting treatment for the high blood pressure, right, to more innovative or sort of technological sort of devices, right. We also work with, for example, smartwatch companies, right, to see whether we can better detect biometric measurements, right, integrated medicine with Chinese medicine, right. So actually there's a lot of things going on, right? But I think the overarching goal is to how we can better prevent strokes, how we can improve the diagnosis, the treatment, and ultimately the functional outcomes of patients with strokes. And of course, in a holistic manner, because it's not just the physical condition, right? It's the psychosocial needs is also very, very important.
Mm-hmm. So a lot of the medical research HKU Stroke and other organizations have been doing can feel really disconnected from everyday people. Could you explain a little bit about how a published paper actually leads to real clinical improvements?
I think it applies to all our research we do is we try to apply it to patients, and once it applied to patients, there will be the beneficial effect to patients. Just for example, we did our research in blood pressure control after ICH. So with that research, we not only bring out the attitude of improve the treatment for the patients, we do the research, and you can see that based on our research, we are able to show that getting good blood pressure control will improve the patient's functional outcomes and also prognosis. So with that, we are able to apply this to our real-life clinical practice, in which we are able to treat our patient more aggressively, get the blood pressure control much better to improve their prognosis. Another thing about research is actually, in fact, like for example, in terms of primary prevention. So we are doing a lot of, based on the results of our research, we're able to show our research to public, raising awareness of stroke preventions, and also hopefully using our data, we're able to change attitudes of the society, and also working with government to actually raise awareness in terms of stroke care and education in this community.
So HKU Stroke has led to clinical improvements through their research with developing the TREACH score that helps doctors decide whether they should prescribe a bigger pill to their patients who had just had brain bleeding. Is that correct?
Yes, so thank you for asking for this research. So for the TREACH score, it's mainly targeting patients with strokes with brain bleeding. So for strokes, there's two kinds of strokes. First is ischemic stroke, is where there's a blood clot in the brain that blocks the artery. And the brain bleeding is when the artery bursts and the blood spill out to the brain, and that causes damage. So the TREACH score is mainly for brain bleeding. So the reason why the artery burst is mostly due to high blood pressure. A lot of patients have very high blood pressure, up to 200 plus on admission. And we note that if we gradually increase the blood pressure medication, it takes like months until we achieve a good target. So the TREACH score, we developed this score to select patients that we can give at least 3 pills within like few days of their brain bleeding, and this will dramatically improve their blood pressure control quite quickly. And the reason why we do that is because the longer it takes to achieve the blood pressure control, the patient exposed to risks like recurrent strokes, heart attack, and death as well. So we want to improve the blood pressure as soon as possible and to improve their survival. But first of all, is also why we want to not give it to all patients, because sometimes some patients may not need so many medications. If you give too much, they may have too low blood pressure, and this may be another problem for the patient as well.
So in the paper TREACH score was introduced, something called therapeutic inertia was brought up. Could you explain what that is and why it happens?
Okay, so therapeutic inertia means that the doctor or patients does not increase the medication when the treatment target is not achieved. So it is applied for a lot of diseases. The most common is actually hypertension, in which we have a target set for patients. So for example, after strokes is less than 130 systolic blood pressures. So a lot of times, doctors, even patients, do not want to increase their medications because they feel they're fine. Because especially hypertension, the complications occurs all of a sudden. You don't have symptoms when you have high blood pressure, okay, unless it's very high. So a lot of times when the blood pressure is around 140, 150, they feel they're fine. The patient's not keen to increase the medications, and the doctor say, okay, it's fine. So we kept that at 140, 150 levels, which is actually in fact not good for patients, because we know that level, you still have heightened risk of recurrent strokes and heart attack and death. So that's why it's called therapeutic inertias. And that does not only apply for stroke patients. In fact, therapeutic inertias apply also for general populations, especially hypertensive patients. Because we know that only 50% of patients with hypertension without a stroke have controlled blood pressure. So 50% of patients do not have well-controlled blood pressure in the populations. Similar applies to this, because a lot of times they feel that their blood pressure is 140, they're not well controlled, and they do not want to increase the blood pressure medications because it's asymptomatic. This is a big problem, because we know with a lot of research that the lower the blood pressure, especially it's under 130, the better your outcome and the reduced risk of cardiovascular events and death.
A lot of the stroke research you do involves high stakes for participants. Are there any ethical considerations that directly shape how your studies are designed?
So I'm very glad you raised about ethics, right? Because definitely when in research, right, we do have to think about these ethical considerations. I mean, in short, right, of course, it depends on the nature of the research, right? Because some of these, may have sort of less considerations, right? I'm not saying there's none, right? But they mean less. For example, if you're doing a questionnaire, if you're doing sort of just reviewing medical records, right? Of course, compared to a new trial or new drug, right? That may be in the pipeline, right? But in short, when we have a research in place, right, we have to write obviously a proposal, right? These proposals, right, will need to go through a board mechanism. So there's an ethics review board where there are different panel members representing sort of different disciplines, legal representatives, etc., right, who will sort of look into the sort of potential ethical issues that this particular research may be, right? But you're very right. When we design research projects, we do need to take these in mind, right? Are we doing potential? I mean, is there any potential harm, right? Have we thought about other ethical conditions, right, or sort of considerations, right? So these are things that we do need to take in mind, and there's a board that takes into these very, very seriously.
Yeah, I think importantly, as mentioned by Gary, is actually we need to make sure what we do, first of all, you don't harm the patients, and of course we have background knowledge and the scientific background in which what we do is actually beneficial for the patients. And in between, we do have some reviews occasionally during trials to make sure that our hypothesis is true and we do not harm the patient as well. So this is something we need to consider during we do studies.
I know that HKU Stroke is always working on new events and publications. What's the most exciting area of work for the team right now?
Yeah, so I think we have a few key passions, right? And one of which is we do want to reduce the burden of stroke, right? And if we can reduce the stroke or prevent the stroke from happening, right, then a lot of different things from the disability from the stroke, right, the morbidity, right, or we know that stroke is the number 2 killer, right, globally, and all the other consequences of stroke will sort of be avoided. And hence we're very keen, right, in preventing young strokes and preventing intracerebral hemorrhages, right? So we are working with all sectors of society, right, so including food industry, technological sort of sectors, right, educational sectors, etc., right, to see how we can sort of in different areas, right, all work together to prevent strokes. So including from what goes into the condiments or goes into the fast food restaurants, right, to sort of devices to better detect blood pressure or sort of simple things, right, working with the government, right, as you see, we have programs to better screen for high blood pressure, etc., right. So these are all things that we have in mind.
So I think for me, I think Gary as well, that I think another part of research is on AI. So how we can use AI to improve the quality of care of the patients. So for me, we have studying some research in terms of using AI to help us decide on what treatment to give our patients, what best to give the patients in terms of strokes as well. So another part of research is actually in terms of rehab as well, smart rehab as mentioned, and also we are exploring some options to do some robotics as well in terms of stroke surgery. So these are quite exciting times. And of course, there's some harm in terms of even things to consider in terms of AI, because it's not, we need to know what can go wrong when you use AI. For example, the over reliance of AIs, this may cause, but in the end of the day, the diagnosis and treatment, the decision is based on a doctor. We can't be over reliant on AI. And second, if if we over rely on AI, sometimes we don't think. So there's some concern that if we over rely on AI, we may not be able to think as a doctor in general. And lastly, another problem with AI is that there's some hallucination in which there may be possibility that the AI may give a wrong diagnosis and treatment option for you, but that will become the previous one. If you're over reliant on that, you won't know what is hallucination. So there's something in terms of AI, even for studies as well, you need to know what is right and wrong when you use AI. Mm-hmm. So the AI literacy is very important as well when you do research and also in terms of using it for your studies. Yeah.
So our final question today is from our audience. The question is, what's one thing you'd say to every aspiring neuroscientist or clinician should understand beyond what's taught in medical school?
I think just riding on the AI discussion, right? We know that, you guys are already adopting a lot of AI it probably is included in your studies, right? There's a lot of hype in it and the prospects in terms of in healthcare, right? But we know that, as Teo mentioned, about the limitations, and hence we should know that, we also need to develop our own critical thinking skills, right? Because we cannot also over-rely on AI, right? Because there are chances that, as Teo mentioned, it may hallucinate, right? Although the algorithm may be 99% correct, right? But that may mean that if you see 100 patients, there may be 1% chance or one patient where the AI may give the wrong answer. Right? So I think we do need to know that we do have our fundamentals, right, and hence our critical thinking skills, right. But also important is the humanities, right, side in the era of AI, right. We know that AI cannot replace the love and compassion, right, of humanistic care, right. So I think although yes, there's lots of potential AI for diagnostics, drug development, etc., right, but it can never replace the love and compassion of sort of clinicians and then sort of human doctors. So I think that's very important.
I think for me, I think one advice is actually to have a growth mindset. I think in terms of what growth mindset means, that you are open to criticisms, advice, and also you're dedicated to work to your goals, and you believe that you can able to achieve the goals. And I think lastly is that when you get a mistake and a challenge, you need to be strong. You want to find help, and you need to determine to actually to achieve your goals through growth mindsets. I think that's very important as well.
Thank you very much.
Thank you. Thank you. Thank you so much.
Thank you.
Okay, we're going to end it now.